I'm Dr. Phani Madhuri. I'm a senior consultant obstetrics gynecology, fertility medicine and laparoscopic surgery at Kiran Infertility Centre, Koramangala, Apollo Cradle Hospital, Jayanaka, Bengaluru. Again, a very common problem that we see in OPD is vaginal infections. It can happen anywhere between young girls, pre-married, pre-sexually active, to very old women up to the age of their 70s, 80s. Any age group can be affected by this abnormal vaginal discharge. Now, what is a normal vaginal discharge? Any discharge, normal amount of discharge is quite physiological. Discharge can vary between transparent to mildly whitish color discharge, which varies throughout the menstrual cycle. It is actually important to keep your vagina soft and supple and moist and protect you against unwanted infections. You shouldn't be dry down there, right? But if the discharge becomes anything abnormal like profuse, you need to constantly keep changing your underwear or use pads to soak up the discharge, or you are having abnormal quality of discharge like greenish, yellowish or reddish, or you are having any smell also associated with the discharge, which is very strongly odored discharge, and if you are having any itching associated with the discharge, then we consider this as abnormal. It can happen because of your variation in your immunity during your menstrual cycle. Like many women have abnormal vaginal discharge during their menstruation and during their pregnancies, or when they are on OC pills, or at the time of their ovulation, or after an unprotected intercourse with the partner, probably who is not obviously symptomatic, but the female can get infected. So these are very classical presentations of abnormal white discharge, and these patients, it can also be because of the hormonal imbalances, like you may be having insulin resistance, you could be having diabetes because of your polycystic ovaries, or you may be obese where there is a lot of sweat collection and there is no aeration to that part, or it can be because of low ovarian reserve where the hormones are declining, so the vagina becomes very sensitive and dry, and this is what probably exposes you to repeated infections. So it can happen because of various things, or sometimes it can be because of some foreign body insertion in small children. They would have just inserted something for unknowingly, and that can continuously cause some kind of abnormal discharge. So it is worthwhile seeing a specialist, getting yourself examined to understand what exactly is the problem that is causing abnormal discharge, and treating it early on to prevent the spread of these infections further into your reproductive tract. Because if these infections are not treated, they can extend into your peritoneal cavity, causing chronic PID, chronic infections into your fallopian tubes, chronic infections into your uterus, and also later on infertility. Yes, we have seen a lot of women who are overweight, who are having hormonal conditions like polycystic ovarian disease, who are using a lot of douches because they're constantly worried about hygiene factors. They're using multiple body washes or intimate washes. They're constantly over cleaning the vagina. So all these things can result in the normal imbalance of the pH of the normal vagina, which can expose the sensitive vaginal mucosa to various infections, like for example bacterial mixed infections, it can be yeast infections, it can be chlamydial infections, it can be gonorrhea, it can be trichomoniasis, or any other STDs, for example. So once you have broken your normal vaginal barrier, the vagina becomes oversensitive and exposed to any kind of infection or inflammation, and repeated itching can again cause secondary bacterial infections, and this can go on further. So I think it's important not to be over obsessive about hygiene and use multiple scented products, especially, which can be potential irritants in that area, because it's a very sensitive mucosal area with a sensitive pH balance. So don't try to irritate that area with any extraneous products. So the common infections that can happen in the vagina are yeast, the bacterial infections and the viral infections, correct? I mean, very easy to pick up because you will have very clumpy, thick, whitish discharge. A lot of patients already understand that it could be the candidal yeast infection. When they come to us, they tell us, doctor, probably I'm having yeast infection. So they're very good at picking up the yeast infections. Now, to differentiate between bacterial and viral, it is usually difficult, but a vaginal swab can often help us understanding the infection precisely if you're having repeated chronic infections. And the bacterial infections are usually, the discharge will be grayish, thinner discharge, profuse discharge, and having fishy odor, whereas the viral discharges may be yellowish or greenish in color, frothy in nature, and they can be associated pain in the vagina or irritation, inflammation associated because of the viral infections. So these are the different types of vaginal infections that commonly happen in the clinical practice, and as soon as you come to us, a simple speculum examination will help us understand what infection is exactly happening in the vagina, and correct treatment like antifungals or antibacterials, and treating both the partners is very important in this condition because it's a cross infection. So you treat one partner and leave the other partner untreated, then the next intercourse catching the infection back from your partner is very common. That's why we prefer to treat the couples in this condition. We treat both the husband and wife for the infections. And also, many times patients ask me this question that my partner doesn't have any symptoms and only I keep having these recurrent infections. Yes, because the partners are usually having better immunity power, and because of the various hormonal changes that the women go through during the menstrual cycle, especially during the menstruation or during the ovulation or during your pregnancy, the vaginal pH gets altered and becomes oversensitive and is highly prone for infections. So that is why the infections are very prominent in females as compared to males. Strengthening your vaginal microbiome or improving your vaginal immunity. Yeah, it's the key to understand this problem, and you can tackle this problem naturally without falling sick so often. How do you overall improve your immunity is how even the vaginal immunity works. So you have to focus on your nutrition, try to have 3 proper meals, home meals, whole foods, have a balanced diet, a mix of all kind of fruits and vegetables, nuts, seeds, sprouts. Also have some kind of a probiotic like your curds or kefir or sourdough or something like that. Have a good probiotic in your meal. And you can also think of hydration. You have to be hydrated well all throughout the day. Good nourishment, good hydration is extremely important to build your immunity. And at the same time, don't be over obsessed about personal hygiene. Don't get into multiple products. Don't use any kind of cosmetics and scented products. Don't wear too much of tight clothing. Don't allow yourself to sweat excessively in the private parts. Taking care of these simple steps will really help you. Just a simple splash with water after your urination is enough. You don't have to clean yourself with medicated or scented products after every wash or during your intimacy every time. So these simple things will help you prevent recurrent infections, and also taking care of your overall body immunity, eating good nutrition, good sleep, good hydration, exercise, keeping your body weight optimal. All these are extremely beneficial in preventing infections. And you can also think of taking HPV vaccine. If you're really prone for multiple infections, taking a HPV vaccine is also very beneficial in improving your overall immunity, tackling various viruses and infections in the vagina, and it is shown to be protective against your other infections as well. So taking care of these simple steps, always try to have protected intercourse and use lubricant jelly if you're prone for vaginal dryness. Taking care of these simple steps will prevent unnecessary cuts, bleeds, and exposure to infections that can happen because of the sexual intercourse.